This University of Missouri School of Medicine laboratory is focused on the highly contagious Delta variant and the immune response in patients who are infected.
We want to know how long their immunity lasts. Are they protected against other variants? And so comparing how different is the response to this virus versus the other viruses.
Associate Professor of Surgery and Molecular Microbiology and Immunology, Dr. Mark Daniels, is the principal investigator. Daniels is starting with the enrollment of at least 100 participants infected by the Delta strain of the coronavirus and any new variant they may identify.
We're working with a number of labs across Missouri to give us patient samples that then we can do sequencing and determine whether or not they've been infected with the variant, and then we'll reach out and contact those individuals to try to recruit them.
First, Daniels wants to see how the immune response differs between demographics.
We're going to get unvaccinated individuals. We will get breakthrough individuals. We'll get the demographic information, their health information, and public health information to determine why did they end up infected now versus later, and a number of other questions that we're interested in.
The research will monitor each individual's immune response and test their antibodies against other variants.
Reagents that we get, the antibodies in their blood, and we can test them against a number of variants. Now, there are other variants that are out there, and we will determine those as we do our sequencing, and we can follow that.
While working to identify positive Delta variant infections, it's possible the research team can identify and study new variants that may emerge in Missouri.
From the PCR sample, the swab that they give, we will take that, and we have a technique where we will sequence the region that we're most interested in that determines the identification of the variant. We're focused on getting the Delta variant because it is the variant of concern now. We expect to find variations in that. And, well, this is why it's an experiment. We don't know what we're going to find. But when we do find, we will utilize as much as we can with a large cohort of samples that we have to look at how well are they going to be protected in the future. We'll hopefully follow these patients over the course of time so we know how long this will last. And then if there's hints that we have about the immune response in these patients that will make it so that we can improve something, we're going to aim for that.
This new study has some similarities to another study Daniels is leading as principal investigator. The research is on the efficacy and longevity of COVID-19 vaccines. He's closely following the immune response in about 600 vaccinated or partially vaccinated study participants for a period of 1 year. Daniel says the data combined from that study and the new Delta variant study may provide tremendous insights for a common goal.
Our biobank that we have is important in the fact that we can utilize that. We can take any pool of antibodies and test them against any pool of viruses. If we can see commonalities, is there a magic antibody that will treat or protect all the individuals independent of the variant from reinfection? Or can we develop a treatment then that we could then provide? Is there something that is better or worse about different vaccines and their ability to protect? Is there something in the demographic of individuals? What do we really need to do? Do we need to have a booster? Do we need to design a more diverse vaccine or a better vaccine?